Welcome back to Mountain Connections, everybody. There is a new service for everybody in the community among the 4 nonprofits right now. If you deal with mental health issues and you are trying to deal with your medications and your prescriptions and everything, well, the next person on the couch may be the person you're going to go see to deal with your medication and your prescriptions. Joining me on the couch, we have Dr. Linsey Broadbent, who is a psychiatric prescriber for medications among mental health. So thank you, doctor, for coming on.
Thanks for having me.
Joining us this morning. So can you talk about your new position and basically what you're brought on to do?
Yeah, of course. So my position is funded by a grant by the Marriott Foundation. Carrie Marriott, who is a local community member, recognized the need for prescription services. We have some options for therapy, but we are very limited in this community as far as where we can go for prescription for mental health.
Yes.
And so she created this grant that serves 4 nonprofit groups. So the Peace House, People's Health Clinic, the Jewish Family Services, and the Christian Center of Park City. And so a lot of those nonprofits provide mental health services, but they don't have a prescriber. So that's the role that I'm filling for them.
Now, I feel like with mental health issues, a lot of the time you hear, go to therapy, get help, get help, get help. Medication is a huge part of mental health issues, and unfortunately, there's a delicate balance of prescriptions and medications, because if something goes flux, it could ruin someone's life. Can you talk about how important it is to be able to have someone catch up on their medications, make sure they're getting the right medications, the right dosage, not overusing?
Yeah, for sure. So we have a lot of scientific evidence that suggests that therapy and medication provide the best outcomes. There are some diagnoses where therapy plays a heavier role in that, and some diagnoses where medication plays a heavier role in that. The tricky part is there's no quick fix for mental health, and so when people decide to take on a medication, an antidepressant or whatever it is that they might need to help supplement their therapy or their other treatments, you have to make sure that you give it a chance. No medications come without adverse side effects, but some of them, if you can get through the first couple of days, they tend to go away, and then if you can give it a full month, then you really can start to feel whether the medication is working as right for you.
And I feel like a lot of times, as someone who deals with mental health issues and was a patient on many medications throughout my entire life, you kind of wanted this instant gratification of, if I take this pill, it's going to fix me instantly. Sometimes that's not the case. Sometimes you're going to do trial and error with certain medications. How intensive will you be with making sure people are getting the right medications, and how often can people check up with you to make sure they are getting the right medication?
Right. So for sure, everybody wants a quick fix, because with mental health, oftentimes people haven't gotten help when the first symptom starts, right? So they suffer for a long time, then they finally are able to ask for help. The help doesn't come very fast. So the important piece of that is the relationship that you have with your provider. And it's got to be a partnership. You have to have somebody that you can talk to and that you can feel comfortable saying, hey, I have this side effect, or this is really uncomfortable, but I need you to address this so I stay on my medicines. And somebody that you can check in with frequently. I like to see patients pretty regularly, especially when they're first getting started, so that we can discuss those things. Sometimes it's not an appointment to change the course of action, it's just to bolster support and say we're doing the right thing. And I think that if you hang in there for a little bit, we'll see something. And if you don't, let me know so we can work on it.
So, and I feel like, you know, again, as someone who's been through this, it's very important to be honest with your doctor, to make sure you're telling them the truth and not lying. And if you're falling off your medication usage at all, make sure you tell your doctor. Will you be working with other doctors in Park City, or, you know, if someone's, you know, maybe seeing a different doctor and then seeing you, will you be bouncing off ideas? Because I remember one time I was on lithium and I had doctors being like arguing whether or not I should be on this medication, whether or not I shouldn't. So will you be talking with other people in the community, other specialists?
Absolutely, and even primary care physicians, right? It's because it really does take a team, and that's kind of the unique piece of this, is that I'll get to work so closely with a therapist, so each patient will have more of a team approach, but then also primary care physicians, other collaborative relationships that I have with people down in Salt Lake, and the mental health community and the medical community is pretty tight-knit as it is. So yeah, the more opinions and the more advice you can get from people, the better to make the best decision for patients.
And where can people go to see you? Office hours? Where can people just get to know more about you? And if they're like, I need help with my meds, where can they go see you?
So you can go to the Christian Center website, and that will have a bio for me and information on how to contact any of the 4 nonprofits. If you're a patient there, you have access to me. And so if you need counseling services, Jewish Family Services provides that, the Christian Center provides that, and then the People's Health provides free care for residents of Summit and Wasatch County who are unfunded, who don't have any insurance.
Perfect. Well, Dr. Linsey Broadbent, it's perfect to have you in here. And again, as someone who's dealt with mental health issues all their life, I appreciate anyone who's willing to step up and help people with therapy and also with medication, because again, medication is the scariest part of mental health for me, because at any moment, you know, again, it's a scale, and if it tips in one direction, it can throw you off. So people need to go see you and make sure they're on the right scale and they're balanced in life. So thank you so much for coming on, Doctor.
Thanks for having me on.
All right, guys, we got more Mountain Connections coming up. Stay with us after this commercial break. We'll be right back.